Good afternoon, everyone. Bancroft Neuro Rehab welcomes you to our Heads Up webinar series. Bancroft Neuro Rehab is a premier provider of post-acute neurologic rehabilitation, offering residential and day services, neuropsychology, and outpatient services at 3 locations throughout southern and central New Jersey: Mount Laurel, Plainsboro, and Toms River. Bancroft Neuro Rehab is a division of Bancroft, a provider of programs and services for people with autism, intellectual disability, and other neurological conditions. Today's program is Executive Functioning After Brain Injury. We'll have time at the end of the presentation for Q&A. And now I will turn the presentation over to today's presenters, Vanessa Edwards, who is a speech therapist at Bancroft Neuro Rehab, and Jillian Gordon, who is an occupational therapist at Bancroft Neuro Rehab.
Good morning, everyone. My name is Vanessa. I want to just tell you today that today's topic is specifically related to brain injury. However, the information that we provide may be applicable to diagnoses of dementia and other neurological disorders. It is recommended to discuss any noted symptoms that you may see or have with a physician, neuropsychologist, speech therapist, or occupational therapist to determine course of care in any case. Following the session, you should be able to define executive functioning and provide examples, identify how brain injury and neurological changes impact executive functioning, explain how executive functioning deficits impact daily routines, and also provide specific examples of therapeutic assessment and interventions used to address executive function deficits. I'm going to turn it over to Jillian at this point now.
Executive functioning is a term to describe the cognitive workings that oversee various skills, select which ones to use, and guide the processing of information to plan or execute the task at hand. There are 12 main focus areas that we will address when assessing executive functioning. This is a more detailed list than you might find out there, which typically includes 8 areas, but we will discuss the role of each skill from our list, how they are affected by neurological injuries and disorders in the upcoming slides. Most of the pictures and strategies that you see in the upcoming slides have a link attached or a reference in our resources. However, the Canva websites that were made by Vanessa, you'll need access to or a copy from her, so you can please feel free to email us this request. Before we get into anatomy, I want you to imagine this. A world-renowned orchestra is about to begin the biggest performance of their career. Every musician is in their seat, their instruments are in good shape, they're ready to go. Right before showtime, they learn that the conductor is missing. They're stuck, right? Well, they could go on and play a few pieces that they've practiced for years and feel confident in performing. That all goes well because it's almost automatic and they don't need to rely on their conductor for that. However, for the finale, the audience is demanding something new. Without the conductor, the show will not go on, or at least it won't go on well. This is a view of a brain which has had changes to executive functions. The conductor is the prefrontal cortex and associated regions which control the cognitive function. This is your executive functioning hub. The individual cognitive skills, just like the musicians, may be intact and ready, and they can react to familiar stimuli and situations, but if the executive functioning is impaired, the conductor is missing, and the skills may not be selected and utilized properly. This may lead to accuracy, efficiency, or safety errors, the inability to complete the task at all, or a behavioral representation of the chaos that's going on behind the scenes. In this presentation, when we comment on the anatomical impact of acquired brain injury as related to the prefrontal cortex, please note that we're using this as shorthand. In reality, the prefrontal cortex is the main driver of executive functioning, but we did find research connecting a few other areas as well. The parietal lobes and subcortical structures that connect the frontal lobe also play a role. The prefrontal cortex contributes to higher cognitive functions, including executive functions of anticipation, judgment, planning, and decision-making. The basal ganglia is involved in selecting and enabling cognitive function. And the thalamus supports the intake of sensory information and decision-making on what to do about it. In particular, the mediodorsal nucleus of the thalamus has been implicated in executive functions such as planning, cognitive control, working memory, and decision-making because of its significant interconnectivity with the prefrontal cortex. The limbic system plays a role in self-regulation, including emotions, behavioral, motivation, sleep, stress response, which plays into social emotional skills, executive functioning, inner drive, and sensory processing. Changes to executive functioning can be caused by any external or internal factor impacting neurological functioning. Causes of executive functioning deficit may include TBI, stroke, tumors, frontotemporal dementia, or other medical conditions like encephalitis or meningitis. Aside from these, some additional medical and psychiatric conditions may also result in executive function impairment. These include long COVID, depression, anxiety, and the most commonly referenced disorder associated with executive functioning, ADHD. For the purpose of our presentation today, we will be speaking from an acquired brain injury perspective. So what does this look like in action? The impact of neurological changes on executive functioning cause the regulation, organization, selection, and effective use of cognitive skills to be impaired. Even simple tasks such as preparing a sandwich, engaging in conversation with friends, or selecting an outfit to wear may become difficult due to issues with attention, working memory, prioritizing, problem solving, and judgment. Difficulty in the processing of multisensory and often competing incoming information results in cognitive and behavioral changes. Because executive functioning integrates information across cognitive domains, deficits appear as a cluster of symptoms. However, executive dysfunction is not a homogeneous presentation. Impairment to executive functioning can have various outcomes. It may look like an individual sitting quietly in the corner waiting to be told what to do, or it might look like an individual jumping up and down in the middle of the room telling everybody else what to do. It may look like someone who's unable to complete their daily routines without guidance, or can't participate in work or school without support. Or it might look like someone who has a very rigid routine and schedule, keeping effective systems in place so that they can execute the tasks that they need to complete. Executive functions impact all daily tasks, ranging from dressing to cooking and routines, including driving to the store, performing work duties, or following a basic morning routine. While some people are able to learn compensatory strategies to manage their daily activities with minimal disruption, some with executive functioning deficits are unaware of their difficulties or how they impact their performance, which is a sign of poor self-monitoring abilities. This may result in failing to meet deadlines and responsibilities in even the most basic of tasks. Many times, difficulties are noted at home, at work or school, and in the community. Serious consequences of these difficulties may be receiving financial penalties for failure to pay bills on time, loss of job due to not meeting deadlines, poor hygiene or diet due to the inability to plan and manage personal needs, or loss of social contacts and isolation due to trouble making or keeping plans. The reason we want to be attentive to and quick in addressing executive functioning deficits is that these deficits often lead to worse outcomes for patients. If we don't address executive functioning, a client's progress towards their therapy goals can be decreased, lessening the impact of our services. Unaddressed executive functioning deficits will decrease the chance of returning to work, lower community integration, and lead to overall decreased independence, which in turn results in higher caregiver burden. In order to maximize our clients' chances of improving their independence, safety, and quality of life, we need to acknowledge and adequately address executive functioning skills. In the next set of slides, Vanessa will be highlighting the distinct executive functioning skills, their roles, some ways that deficits may present, and strategies to address the deficits. Afterward, I will review assessment tools and treatment approaches before we open up for questions.
Thank you, Jillian. So as we go through the following slides, breaking down executive functioning, you will certainly see some overlap and recurring themes. Often the tasks we complete in our daily lives require multiple areas of executive functioning skills, not just one. Often rehabilitation is reteaching a skill, but sometimes a person who sustains a brain injury has never learned the skill prior, thus requiring greater effort and learning. Please also keep in mind that the lists provided are not exhaustive for the sake of time, but if you have further questions, please do not hesitate to reach out to either Jillian or myself. Planning and prioritization is the first one that we're going to discuss. It's the process of making a decision or taking the necessary steps to complete a goal. It allows you to sift through information or tasks to determine which requires your immediate or urgent attention and what is not important in the present moment or at all. Post-its are always fun to have and use as reminders, but if you have too many and they look like this woman's desk here, a person can shut down and become increasingly overwhelmed. A therapist should implement a way to help this decision-making process to determine what takes priority, like the purple chart on the right, which we'll discuss in a little bit. So what does this look like? We're going to break these slides down into what it may look like if someone's skill was intact, if someone's skill was disordered, and the tasks that can be impacted if they have disordered skill. We'll also look at the strategies that you may be able to implement. These are not all-inclusive lists, and again, there will definitely be some overlap across slides. And always remember, there are severity ranges to all these skills. So they may be achieving portions of the skill, but the end result continues to falter. If a person's planning and prioritization is intact, you're going to see a fantastic system in place, which may include a calendar system that they record all important dates without overlap. And they may create a to-do list to stay on top of tasks for the day or the week. If the skill is disordered, they may have overlapping events in their calendar or their calendar does not even exist. They have difficulty meeting deadlines, or they may wait until the very last minute to begin a task that they have known about for a while. You may see that individuals have difficulty completing their therapy homework or making plans with friends or family. Their laundry may also begin to pile up over the week. When we think about strategies we may need to use to improve our planning and prioritization, we may implement something like the Eisenhower matrix, which was the purple chart that we saw on the previous slide to build this skill. I'll play a short video in a little bit so that you can better understand this Eisenhower matrix. They can also use a calendar or to-do list, which is going to be a trending strategy across multiple skills, but it works wonders. When you are planning, also plan for interruptions. So it's separated into what's urgent, what's not urgent, what's important, and what's not important. And President Eisenhower was the one that actually introduced this type of chart to help him with decision making. Whether it was him or his staff, I'm not sure. But what happened was, if something was extremely urgent and important, they put it in that first quadrant to do it right now. If it wasn't urgent, but it was important, it was something that they needed to plan to do. That would be the second quadrant in the top right. Down in the bottom left would be something that's urgent, but not as important. So therefore, they would ask for help or kind of delegate that task. If something they found was not urgent nor important, they would just drop it from the list of what had to be done. So we're going to move on to time management. Time management allows a person to determine the constraints of time on a given activity and complete said activity with increased effectiveness, efficiency, and/or productivity. Learning this skill may require use of external strategies initially, but before internalizing them if the person is able. An individual whose time management skills are intact may exhibit timely responses to emails or phone calls. They are often able to complete tasks on time or even ahead of schedule. You may notice that their calendar includes smaller tasks in order to complete a larger task by the deadline. For instance, if someone has a presentation due in 3 weeks, every Friday they may have written complete X, Y, and Z by this date so that their task can progress as needed and they'll be finished by the deadline. For an individual who has disordered time management skills, you may notice that they are constantly rushing or their quality of work is poor because of the procrastination that exists. They may also experience burnout because they feel like they are inundated with tasks and always have that feeling of barely treading water. I'm sure most of us have experienced this at times, especially when life gets busy, but people with disordered executive functioning have a hard time pulling themselves out of that water and using strategies to be effective. Some examples of tasks impacted are the ability to have all components of a meal cooked and ready to go at the same time and not have to reheat them when everything is done. They may even bring up very important topics at the end of the meeting, even though they had these concerns at the start of the meeting because they're not keeping track of the time. Now, of course, if something comes up during the meeting and they only have time to talk about it at the end, this would not be a deficit in time management skills. Time management is a skill that takes time to develop, no pun intended there. And for some of us, it is innate because of the environment we may grow up in, but that does not mean that the skill cannot be lost following an injury. I like to teach someone to use what's called backwards chaining, which is a strategy that can be used for many skills. When you teach backwards chaining, you are first teaching someone to break a task up into smaller steps, then teaching and reinforcing the last step in the sequence to be the first, the second to last step to be the second, and so on. So for instance, if you have to go to a doctor's appointment and you have to be there by 2:30, you think about how much time it'll take for you to drive. Say it takes 30 minutes, so you back up your time to 2 o'clock. Then you have to counter in the time it takes for you to get ready, meaning shower, dress, getting all your stuff together. And that might take, I don't know, maybe an hour, 2 hours. So now you have your starting point of when you actually have to start getting ready for that doctor's appointment, which would be 12 o'clock, in order for you to get there at 2:30. Some other strategies may include delegating tasks or using a stopwatch or timer so you don't forget about the laundry that's in the washing machine, which I'll have to go home and change soon. We're going to move on to organization skills. These skills allow you to deliberately create order to your work or leisure activities. There is no one-size-fits-all solution, and sometimes it takes trialing a couple different methods to organize one task to find the one that will stick. Knowing what your strengths and weaknesses are regarding organization is helpful to find the most effective strategy quickly. So individuals with intact organization are able to locate items or information rather quickly. Their environments are often less cluttered and they are much more efficient with task completion. A person with disordered organization skills often appears scattered or their personal spaces lack order consistently. Someone may have a messy desk during the workday, but this may be related to their workload and not their poor organizational skills. An inability to follow directions because their thought organization is disordered, or the likelihood that items will be misplaced are also signs of disordered organization skills. A deficit in organizational skills can impact an individual's ability to pay their bills, as they may lose them or not open the bills as they come through the mail. Decreased organizational skills that affect their environment, causing it to be more cluttered, can impact a person's stress level and impact their success in task completion. So some strategies that can benefit organizational skills are our favorite, using a calendar, but going a step further and maybe color coding that calendar so that all your work items are one color and all your personal items are another. This will also play a role in someone's attention. As they search for an item related to work, they only have to attend to maybe the color red that all the work items are in. Using filing cabinets and binders with the addition of labels can improve organization of paperwork. If there is difficulty expressing themselves in an unorganized manner, writing these thoughts out can improve the disorganization of those thoughts and improve their communicative intent. So working memory allows you to hold on to information as you need it in order to complete a task. It's where the brain processes, holds, and manipulates information. It's also one of the main areas of executive functioning. When a person's working memory is intact, they are able to recall information with ease while completing a task. If they are alternating between a task or transferring information from one location to another, they can hold on to a decent amount of information without having to reference it again. Conversation comes easier, and they can recall information from past experiences or events so that they can add to the conversation or comment on a topic discussed earlier in the conversation, thus allowing it to be easier to maintain relationships. When working memory is not within functional limits, an individual will repeat information during the conversation or repeatedly ask the same questions. They may have difficulty remembering the word they need to use in their conversation as it progresses, or which direction they intended the conversation to progress. So I've talked a lot about how conversations are impacted by working memory, but some daily tasks that can be impacted are managing finances, forgetting what bills have been paid or whether they paid the previous month. An individual may have difficulty purchasing all needed items from a store, or adding too much of an ingredient to a recipe because they duplicated a step. There are several strategies that can be used for working memory, and again, there is no one-size-fits-all fix to disordered working memory. Sometimes it takes trying a few of these strategies until you find one that fits the task you need in order to succeed within. Establishing routines is huge to improve memory in general. However, using to-do lists or checklists can specifically improve your working memory deficits. Crossing things out as they are completed will assist with remembering where you are on your to-do list. And also reducing multitasking is also effective to allow less information to have to be stored at a time. Metacognition. So this is having self-awareness about your own thinking. It is knowing what we know and what we don't know. It's an important skill because if we want to learn, we need to know what we need to learn in the first place. A person's intact metacognition is able to reflect, a person who has intact metacognition, is able to reflect on a situation and make the appropriate changes in order to increase their success. They tap into their prior knowledge, stand back and take a bird's eye view of the situation before making a decision on how to complete the task. Disordered metacognition may present itself as someone who makes poor decisions or does not weigh the pros and cons of a situation before acting upon a solution. An individual tends to have decreased self-awareness, which can significantly impact multiple tasks. This is why I say that everything has the potential to be impacted if metacognitive skills are not intact. If a person is unable to reflect on themselves or identify their strengths and weaknesses, their ability to be successful in any task becomes unstable. So strategies that can be helpful in first improving someone's awareness are using a form of prediction. So say, for instance, prior to giving that person a task or an activity, you have them identify how they will do on the task or the perceived challenge they may have. Using a rating scale to make this more concrete and comparable within and across activities can be helpful. Another strategy may be to think the process out loud. Sometimes when we talk through something out loud, we allow ourselves the opportunity to improve this auditory loop and process and analyze at the same time. Always teach someone to ask themselves questions throughout the process, like, how am I doing? Did I do this right? So that they can make adjustments as needed. These next two skill areas are very similar and typically go hand in hand. On this slide, we are referring to the ability to control a behavior or a response that is undesirable for the situation. So an individual whose response inhibition and impulse control are intact, they have the ability to pause before responding or reacting. They also have a higher tolerance for their emotional triggers. Disordered response inhibition and impulse control may look like an individual whose frustration tolerance is poor or limited. They may respond inappropriately or out of their normal response that they would have said prior to their injury. They may also increase their participation in risky behavior without recognizing or thinking twice of the consequences. You may see their relationships become impacted or their ability to sustain their employment because their responses to people become inappropriate or unwelcoming. Their behaviors may make others feel uncomfortable, thus developing distance within their personal relationships. Strategies that can be effective are a structured approach like stop, think, go, or choose, whichever you prefer to use there. So first, you're teaching the person to stop, take a breath, to calm down, consider everyone's feelings, and describe what they may be feeling. Then you want to teach them to think, which is often the hardest for these individuals and may require direct supports initially. But think of the problem and the possible solutions. Are there any consequences to those solutions, or are they fairly safe to follow through with? Then the last is go or choose. And it's exactly that, the decision you come to, which allows you to respond or act in that situation. Another strategy can be counting backwards from 10. Counting backwards makes it more intentional, whereas counting forwards is more automatic, and you don't often think while you're doing an automatic task. So counting backwards can help you calm or slow your response. Sometimes writing down what you want to say to someone before responding can be helpful. Of course, that's if time allows, and you want to reread what you wrote and rephrase it as necessary. Question whether the response has any consequences, or is it necessary to state some of the things that you had written down, or would it heighten the emotion of the situation? Which brings us to emotional control. Emotional control is certainly a skill we work on throughout our lives as situations become more complex. The basis of emotional control is first being able to identify the types of emotions. A person must be able to understand that emotion and how to adapt it as needed to complete a task and not allow the emotion to interfere. A person with intact emotional control has a very high emotional intelligence, which is the ability to perceive, control, and evaluate the emotion. They are also able to acknowledge or have awareness of another's emotions and respond accordingly or adapt as needed. Disordered emotional control may look like an individual having outbursts or the inability to bring these emotions to a stable state without someone else's intervention. Again, just like the previous slide, relationships, socialization, work environments can all be impacted by poor emotional control. These individuals may also have difficulty adapting to new environments or changes that occur in their lives without having a heightened emotional response. So some effective strategies are being able to identify and reduce the triggers that cause that specific emotion. You can also use positive self-talk to help with regulating or returning the emotion to a more stable state. Applying a color identification to emotions, as seen on the previous slide, can assist with identifying the emotion felt in the situation. So if we go back to that previous slide, you can see that the place you really want to be in is the green zone. When you're in the blue zone, you're kind of feeling tired, sad, sick. It's your rest area. Your green zone means that you're focused, you're calm, you're happy, and you're ready to go. The yellow zone means that there's a heightened state of alertness. A person has some control when they're in the yellow zone, but they begin to start experiencing stress or frustration, anxiety. They start to maybe get really excited or be really silly in the moment. So that's when they want to slow down. And then the red zone means that you need to stop. This zone is where you're experiencing anger, rage, you're having explosive behavior. So applying a color to that emotion can help you better understand what you're feeling as well. Now, moving ahead, we have task initiation. And that's being able to get started on a task in a timely and efficient manner. An individual within task initiation can take on new tasks immediately. This does not mean that they do not have questions about the details of the task, but they are able to begin without hesitation. Disordered initiation may be described as task avoidance, but really the individual is just having a hard time getting started. They want to do it, they just don't know how to start. They may spend more time on a leisure task than on the required task, such as browsing their phone instead of getting started on folding the laundry. You may see an individual with disordered initiation have that laundry begin to pile up, or their room becomes unkept. Their assignments at work or in school are often late, or they are asking for extensions. Some effective strategies are using a countdown timer as an external stimulus as you to get you going. Exercising prior to initiating a task is often helpful as it provides additional stimulation. Remembering to schedule in brain breaks in your daily schedule is helpful as it can be rewarding and used as an incentive. Breaking down a task into smaller steps is helpful and allows you to perceive the large task as being more manageable. Of course, once you initiate a task, can you persist? Goal-directed persistence refers to the ability to set, recognize, and remember a goal as we plan and stay on track with carrying out steps necessary to achieve them, including overcoming obstacles which are bound to present themselves along the way. Can we stick with it? This is one of the last executive functions to mature for many individuals. Intact persistence may look like someone who is motivated to complete a task, or they present with the ability to push through a problem in order to solve it. Disordered goal-directed persistence may look like an individual who is unable to return to the task after being interrupted, or they have difficulty recognizing their mistakes. This person gives up easily on tasks, or they blame others for their poor performance. Tasks will often be incomplete, like a presentation that is supposed to be done, and it doesn't have sufficient detail or a clear ending. Their productivity at work may be poor, and they have significant difficulty with multifaceted tasks, as often all of them become incomplete. Helpful strategies that you can use are developing what we call SMART goals. So SMART in SMART stands for specific, measurable, achievable, relevant, and time-bound. Defining these parameters as they pertain to your goal helps ensure that your objectives are attainable and within a certain time frame. Using positive self-talk to encourage yourself to complete a task can also be helpful. Providing yourself with rewards once you finish a part or the entire task can help with persistence. You can set a timer or reminders to either take breaks or remind yourself where you should be within your smaller goals. Flexibility may also be called mental flexibility, cognitive flexibility, or thought flexibility. It is generally considered flexibility. It's a behavior of switching between tasks and demands in response to changes in the environment. Intact flexibility may look like an individual who can shift between tasks or goals with the ability to think outside the box. They are more willing to try new challenges differently. They have the ability to rephrase a statement when their listener does not understand their intent. Or they make smaller changes to assist with adaptation to larger changes that may occur. If flexibility is disordered, a person's thinking may be very rigid, and it may be difficult to get them to see your point of view or perspective. They have minimal ability to negotiate, often believing that their way of thinking is the only way. They may continuously try the same solution despite the fact that the solution does not work. Cooking is a great example of how flexibility can impact this task. Maybe you are cooking and you need to substitute an item, but you do not have the ability to have that item or know what to substitute the item with. Or a person has difficulty accepting the substitution and scratches that entire recipe. Some effective strategies are teaching perspective and assisting with development of alternative perspectives different from theirs. Assisting the person to write out the anticipated changes that can occur when presented with a situation is also helpful. Sustained attention is the ability to attend and focus on one specific task while disengaging, or sometimes known as alternating attention, is the ability to withdraw your attention from one stimulus to focus on another. The intact skill in a person may allow them to complete a book or an article and able to ignore distractions that occur or preemptively put distractions away. A person with disordered attention may begin doodling during a meeting or exhibit increased restlessness when listening to a lecture. They may have difficulty switching between tasks and often terminate the task early due to frustration. You may see this difficulty show up when a person has to answer a phone or a question from a person who may have walked into the office and then go back to the task that they had stopped in order to do those things. Cooking may be impacted while reading the directions in the recipe and then following through with the directions without having to repeatedly refer back to the directions. Some strategies that can be effective are working in a tidier environment. Reduce those distractions so that you don't get sidetracked. You also want to minimize sound interruptions, maybe putting in some headphones, or if you have the ability to close the door. Self-talk can also be effective to help you maintain that attention, as again, it closes that auditory loop and can decrease some of those internal distractions that are often hard to minimize. So our last one that we're rounding out is regulation of processing speed. Refers to the time required to respond to or process information in an individual's environment. It's when a person can consciously decide how slowly or quickly to perform a task. It's also when they can consciously make a decision based on its value and importance. It should be noted that slow processing speed is not an indicator of intellect. Someone with intact processing speed is able to receive information well and does not appear to have any lag time when responding to their communication partner. Disordered processing speed may present as a person missing their deadlines for tasks assigned to them. They may require increased time for decision making as they can become overwhelmed with multiple tasks. They may also have difficulty with mental math. This can impact conversations where a person may respond with what immediately after their partner says something, but then responds appropriately to the question or comment. This deficit can also be because someone is not fully attending to the conversation as well and not directly related to processing. Reading emails, books, and articles can take longer to complete, or a person may have to read them multiple times to process the information. So when you're looking at strategies for processing speed, make sure you're realistic with setting the expectation. If you have a book that you need to read, don't think you're going to read it in 3 hours. Break it up, give yourself realistic expectations, because you have to consider that you may have to reread the information in order to process it. So it might take you a couple days to actually read that book. And as always, make sure you're taking breaks so that your brain has time to kind of catch up, which applies to most of these executive functioning skills that we've discussed.
I just want to applaud everybody for using amazing executive functioning skills for number one, Vanessa putting together those beautiful slides, and everyone else for sitting through all of those. A lot of information, but it's really, I think it's some pretty quality stuff, although I might be a little biased. So I am going to try to get through the remaining slides fairly quickly so we leave time for questions, but bear with me as we work through assessments and intervention. So the purpose of assessment of executive functioning is to identify strengths and weaknesses of our clients in order to develop appropriate intervention plans for the greatest outcomes. It's important to note that due to the overlap of several executive functions, it's not always possible to isolate a skill to identify which ones are impaired and which are intact. We do our best to use assessment data compared with the descriptions of the individual executive functions that Vanessa gave earlier, and initiate some strategies and determine their effectiveness to support our clients' needs. When we're considering executive functions, there's two subcategories to explore, and the identification of difficulties and treatment are going to be different depending on which is impaired. So impairments of organization skills like attention, sequencing, planning, working memory, abstract thinking, and problem solving are going to look a little different than impairments with regulation skills, which would be initiation, emotional regulation, inhibition, and decision making. So there's a lot of different types of assessments, both formal and informal, that we can use in therapy. Included are observation, interviews, assessment, questionnaires, and standardized assessment tools. Clinicians have to consider that self-report or questionnaires may not be entirely reliable due to the limitations in awareness that are usually a key factor in executive functioning for our clients. Therefore, it's really important to use a combination of assessment styles to get the big picture of a client's executive functioning performance. Observation of ADLs and IADLs in the environment in which the task is typically performed often provides the greatest insight to the therapist. So those observations allow the therapist to assess the skills in the natural environment, and the task can include anything from completing a simple recipe, planning for a party, writing a to-do list, or other tasks that require planning and execution of several steps. It's especially useful for engaging clients with difficulty participating in non-preferred activities, as preferred activities can be observed and assessed, which are a little less formal and less standardized, but you can get more buy-in from the client that way. So therapists can also develop their own grading scale for any of the observed skills if measurable data is needed to be collected to demonstrate goal attainment or progress. I've done this in my own practice a lot when the thin scale or other assessments don't quite fit my need to capture specific or minor changes in skill. And I find it really helpful to kind of observe the same task in a repeat fashion. So the highlighted components on this slide really just show ways that a client can demonstrate their abilities in all of the executive skills. After observation and attention to these skills, we can highlight the areas in which they need to develop. As mentioned, insight and awareness of the impact of their deficits may not be a strong suit of our clients with executive functioning deficits. For this reason, it's important to include not only the client, their caregivers, in interview regarding their skills. As self-monitoring and insight are often limited in my clients with executive functioning impairments, I like to complete an informal self-assessment with them towards the start of their care. This allows me to better understand what they recognize within themselves and if they're able to identify a need for change. It also serves as an educational tool when we do a joint review of the sheet after they fill it in. And again, at the end of their treatment, to highlight gains made in therapy. Vanessa, I'm not sure if you can open the doc for presentation.
Yep, we have it open.
Excellent. So this doc is a really helpful tool to provide education in a simplified manner. It highlights the names of the skills, the impact on our lives, and then relatable examples of what an impairment might look like. This can help the client recognize their own limitations and support their buy-in for addressing them in therapy. I adapted this from a chart that was aimed towards children and students, because most of the resources out there for addressing executive functioning really does aim towards children. So we kind of adapted it and made it a little bit more relatable for our adult clients. It's not unusual for someone to initially rate themselves with very few deficits, but the visual tool provides a bridge for discussion versus me simply explaining what I've observed and then usually being met with resistance or denial. Some of the ones that I like to pick out and highlight with my clients include: you often ask people to repeat themselves, or you lose your train of thought. My favorite during this activity is you get surprised when someone gives you negative feedback. With these, I can give specific recent examples to highlight why I would consider them to be impaired in certain areas. And it really does open up the, the gates for discussion there. So I'm not going to get too in depth with the questionnaires, but each of these questionnaires is rated on a Likert scale, with the DEX and the CFQ being rated never to very often, with higher scores indicating greater reports of executive functioning problems. And the Boston University AMPAC, the Applied Cognitive Domain, that one is rating on a scale of no difficulty in an activity to you're unable to do it. And again, the higher score, actually there, I think the lower score indicates that you have more difficulty. Moving on to standardized assessments, there's several options, and for the sake of time, I'm just gonna grab a few. The EFPT is one of the ones that is most often cited when you're looking up information on executive functioning. It takes about 30 to 40 minutes, and all 4 portions need to be administered. The client is tasked to do simple activities that they would do on a daily basis: make a phone call, take a medication, cook, and pay a pretend bill. They're rated on their level of assistance, and the participant also completes self-reflection components. I like this one because it gives you exact examples and definitions for different types of cueing and how to progress the cueing while providing enough space for the person to work through their issues and demonstrate their strengths. Another one is the brief adult version. It takes 10 to 15 minutes, and it looks at several different scales related to executive functioning. I think that the TOVA looks very interesting. I don't have experience with it personally, but it is a device that tracks response, and it looks at consistency, speed, impulsivity, and focus and vigilance. But it does require the purchase of the specialized hardware. And then finally, the favors is one of the ones that we use often, and we like it because it really targets aspects of complex communication, verbal reasoning, and executive functioning. And it's designed to detect deficits that aren't really apparent on typical standardized tests. There's a couple examples of tests that cover components of executive functioning. These are going to look really familiar to a lot of people. We have the trail making verbal fluency test, the clock drawing test, Stroop, and Wisconsin card sorting. Again, they're not looking at total executive functioning, but they are looking at some components. I provided a case study in here. I'm not going to read it to you guys. So yeah, I'm not going to jump into all of the details, but basically I wanted to highlight how client interview and informal assessment via observation and kind of like observation and assessment of functional patterns can give you a good idea of how to address deficits.